everyone. Thank you for joining us today to talk about cancer-related pain. I'm Dr. Meera Ragavan. I'm a thoracic medical oncologist at Kaiser Permanente in San Francisco, and I'm joined today by my friend and colleague, Dr. Karan Jatwani.
Hi, thank you, Meera, for the introduction. Today, we'll be discussing a very common cancer-related symptom, pain. In this talk, we'll review types and causes of cancer-related pain and some of the treatment strategies that include both medication and non-medication based strategies to help with the pain and when to suspect a serious cause of pain. Some of the basic resources for the patients who are experiencing cancer-related pain. Meera, to start us off, could you tell us a little bit about what are the different types of pain patients with cancer that they could experience?
Yeah, definitely, Karan. So pain is a really common symptom that patients with cancer face. Up to half of all patients diagnosed with cancer may experience some type of pain over the course of their illness. And pain can range from very mild to very severe. At times, it can be life-threatening. Pain can be related to the cancer itself, such as tumors in the bone or in the liver and other organs. Pain can also be related to cancer treatment, such as nerve pain that can occur with chemotherapy or bone pain that can occur with some of our hormone treatments for breast and prostate cancer. Pain can also occur after surgery to remove a cancer, so post-surgical pain. And then finally, there may be pain that isn't related to cancer at all, such as chronic back pain that patients may have prior to a cancer diagnosis, but that can be exacerbated or more pronounced by illness or by stress. So Karan, could you talk a little bit more about that?
Yeah, so I think it's important to think of, and I'm just giving you a perspective of how the physicians think about pain whenever a patient comes into the clinic. We think about pain as the concept of total pain. By total pain, what I mean is that the pain that could be, caused by the cancer itself, or could be because of some chronic conditions, as you mentioned, back pain, but also we take into account some of the other factors, meaning pain can be more stress related. Stress could exacerbate the pain. So keeping in mind the global context of the patient, what by that I mean is, are there any psychosocial stressors that the patient is experiencing that is causing additional sort of increase in pain for those patients? So just to broadly classify pain, we say that the cancer patients might experience this total pain, and under that subcategory we bring in cancer related pain as you described.
Great, Karan. That was really helpful. So next, could you talk a little bit about, for our patients who are experiencing pain, who can help manage pain on the healthcare side, on the healthcare team?
Yeah, and I think so let's start by whom the patients could reach out to if they have pain, right? And that could be anyone from the healthcare hierarchy, whether or healthcare team, so to speak, whether it's a triage nurse or whether that's a nurse practitioner, whether that is someone who's taking their vitals or someone who is helping make their appointments. It could be anyone. Um, Coming to who is sort of the person that they should reach out to if they need to get pain medications or help managing the pain, this is where we have different people that could be available at patient's own institution or wherever they are seeking their cancer directed therapy. um, it could be their oncologist. Sometimes oncologists or cancer doctors can assume the role of a provider that could give them pain medications or help them with pain. It could be a palliative care physician. And we are seeing, it has been more and more recognized in the oncology field, being palliative care being closely integrated with our oncologists. It could be a pain specialist, which could be from the anesthesia world. It could be a primary care physician. So I think ranging from their specialized care, which is being provided to them by their oncologist, all the way to their primary care physician, they could reach out to, or the patients could reach out to anyone mentioning about their pain or seeking help with their pain.
Yeah, that's helpful to hear that there are many people on the healthcare team who can really help manage pain.